Okay, let's unpack this. Welcome back to the Deep Dive, the place where we take stacks of high-level research and really distill the critical knowledge you need to be truly well-informed.
And today we're focusing on metabolic health.
Right. Specifically, how we predict the risk of dyslipidemia, those abnormal cholesterol and fat profiles that are a major driver of heart disease.
For decades, we've pretty much relied on standard lipid panels. But the reality is, major health issues like cardiovascular disease are, well, they're rarely caused by just one number being off.
It's more systemic.
It is. They are the result of systemic metabolic dysfunction. So what we're diving into today is a new way to measure that total dysfunction.
And the source for this deep dive is a really groundbreaking study. It provides a new predictive marker that combines both inflammation and insulin resistance. We are focusing on physical activity modifies the association between C-reactive protein triglyceride glucose index, CTI, and dyslipidemia.
It's subtitled, Evidence from a 10-Year Chinese Cohort.
Exactly. This was published in the Journal of Sports Science and Medicine in 2026, volume 25, pages 112-129. The authors are Wang, Zixuan Luo, Zihan Zhou, and Xiaoquan Zhang.
And this research is highly relevant, really, no matter where you live. Dyslipidemia, that abnormal level of triglycerides, LDL, and HDL cholesterol in your blood, it's a global public health crisis.
It really is.
The situation is particularly stark in the cohort they studied. In China, for instance, over a third of adults have dyslipidemia, but the control rate is tragically low.
How low are we talking?
Less than 8% of those individuals actually achieve proper lipid control.
Meaning most people are walking around with a ticking time bomb they aren't managing effectively.
Exactly. We need better, earlier warning systems. So our mission today is to explore the predictive power of this new composite score, the CTI, and this is the fascinating part, to understand the crucial role physical activity plays in changing the entire meaning of that risk score.
Let's start with the biomarker itself then. The C-reactive protein triglyceride glucose index, or CTI. It's pitched as a holistic view of metabolic risk. Why is this combination, superior to just looking at individual markers?
Because metabolic disease is a chain reaction. When you develop problems with fat and cholesterol, it's usually because two fundamental processes are broken.
Okay.
How your body handles sugar, so insulin resistance, and the amount of low-grade systemic stress you're under, which is inflammation. CTI integrates both of those core drivers.
So it's like combining two essential dashboard lights into one master warning signal. What exactly are the components they use?
They use highly accessible markers, which is key. For the insulin resistance component, they use the triglyceride glucose index, or TIGE.
Right, I've heard of that.
Yeah, it's already a well-accepted surrogate measure for insulin resistance. Then they incorporate systemic inflammation, measured by high-sensitivity C-reactive protein, or hsCRP.
So if your TIG is high, you're struggling with glucose processing. If your CRP is high, your body is under this chronic inflammatory stress. The CTI calculation just takes those numbers and merges them into one score.
That's right. And the index is superior to looking at TIG or COP alone because, as the researchers emphasize, dyslipidemia is really the outcome of these two mechanisms interacting. They compound each other's adverse effects on your liver and your fat tissue.
Here's where it gets really interesting. CTI isn't just a theory, right? It's been shown in previous studies to predict things like type 2 diabetes and coronary heart disease. But this study is special because it follows thousands of people over an entire decade to see if a high CTI score today predicts new cases of dyslipidemia 10 years down the road.
That's a powerful perspective view.
It gives the findings immense credibility. They use data from the China Health and Retirement Longitudinal Study, a huge resource known as CHARLS. They tracked nearly 8,000 adults aged 45 and older.
And they were all healthy at the start? All metabolically healthy at baseline? Yes. That's a huge, relevant demographic for this kind of disease progression.
Absolutely.
And over that 10-year span, they documented more than 2,000 new cases of dyslipidemia.
And how did they define that? Is it just a blood test result?
They defined the outcome pretty broadly. So it means someone either showed abnormal blood levels for cholesterol or triglycerides, or they had started taking lipid-lowering medication because a doctor diagnosed them with the problem.
Okay, so a real-world diagnosis. So what did the 10-year tracking reveal? If my CTI score is on the rise, how worried should I be?
They found a very, very consistent signal. For every incremental step up in your CTI score, your risk of developing dyslipidemia rose by about 9%.
9% per unit?
Yes. And if you compare the individuals with the absolute highest CTI scores, so the top 25%, They had a significantly higher overall risk compared to those in the bottom 25%.
That 9% per unit increase might sound small, but when you're talking about a metric that can shift dramatically, that risk really compounds. And they made sure this wasn't just due to other factors, right? Like participants being older or already having diabetes.
Oh, absolutely. They adjusted for virtually everything you can think of: age, smoking, drinking, education, presence of other chronic diseases, and critically, the use of anti-diabetic or blood pressure medications.
And the finding held up.
It held up. CTI provides an independent layer of risk assessment that existing clinical markers or even your medication status just don't capture.
Now, let's dig into who is most vulnerable when CTI rises. Because risk, as you pointed out, is never distributed evenly.
That's right. And two major subgroups showed a really amplified risk. The first one was sex. The association was much, much stronger and highly significant in men.
Really?
For men, a rising CTI score signaled nearly a 20% higher risk for them, which is much higher than the general population finding.
But interestingly, the correlation wasn't statistically significant in women. That seems counterintuitive. Are we saying the CTI metric just isn't useful for women, or is the biology truly that different?
It's likely a combination of things. The authors discuss how, especially in this 45-plus age range, women may still have some residual protective hormonal buffers, particularly estrogen, which can shield against the specific metabolic breakdown that CTI measures.
I see.
They also noted differences in body fat distribution. Visceral fat is a huge inflammatory driver, and men tend to accumulate more of it, and earlier. The point is, if you are a man, that CTI score is ringing a much louder alarm bell.
Okay, so it's a highly sensitive predictor for male metabolic deterioration. What about age?
Well, they found CTI was a more potent predictor for middle-aged adult, so the 45 to 59-year-old group.
The pre-retirement years.
Exactly. For them, a rising CTI corresponded to a whopping 21% jump in risk. The risk was still present in older adults, 60 and over, but the effect size diminished. This suggests that CTI is arguably best used as a preventative screening tool for people in their late 40s and 50s.
That's key. It means we have a substantial window in midlife to use CTI as a signal for targeted intervention, before the risk becomes fully matured cardiovascular disease.
Precisely. If we wait until they are 65, a lot of the damage may already be done.
So speaking of intervention, let's talk about physical activity. We know exercise is generally good. It improves insulin function. It's a powerful anti-inflammatory.
Right.
Theoretically, it should directly suppress the two components of the CTI score.
It absolutely should. Exercise improves glucose uptake, and it's known to reduce the circulation of pro-inflammatory markers like TNF-alpha and IL-6. And this is where the study reveals its most intriguing finding.
One that seems at first glance kind of counterintuitive?
It really does.
I agree. When the researchers stratified the participants into groups based on activity level light, moderate, and vigorous, they found that the CTI-related risk was strongest in the vigorous activity group. For every unit increase in CTI in those who exercise vigorously, the risk appeared to jump the most up to 28% higher compared to just 10% in the light and moderate groups. So why would exercising hard make a high CTI score look more dangerous?
This raises such an important question, and it requires us to look beyond simple linear thinking. If we connect this to the bigger picture, the findings suggest that vigorous exercise is acting as a powerful buffer, almost like a security system for your metabolism.
Tell me more about that buffering idea.
Okay, think of vigorous, sustained physical activity as installing a high-grade security system in your body. This system handles small to moderate metabolic threats, so low to moderate CTI scores, so effectively that the risk curve stays almost completely flat. In the light or moderate activity groups, the risk rises steadily with CTI. It shows a linear relationship because they lack that robust protection.
Okay, so the vigorously active people are walking around shielded, and for a while, the CTI isn't even registering their risk yet.
Exactly. But when their CTI score climbs very, very high, it means the underlying metabolic dysfunction, that combination of high insulin resistance and systemic inflammation, is so powerful that it finally breaches that high-grade defense system.
So the alarm finally goes off.
The alarm finally goes off, and when that high CTI does translate into risk, the association looks suddenly steep because it had to overcome such a strong defense.
So the strong association they measured in the vigorous group isn't proof that exercise is making things worse, but it's proof that the high CTI score is potent enough to overcome even the strongest physiological adaptations.
Precisely. And there's one more layer of nuance here. The authors found that for the vigorous group, the risk curve actually plateaus at the very highest CTI values.
It flattens out.
It flattens out. The protective effects of that sustained high-intensity exercise prevent the risk from continuing to climb indefinitely. They are still protected from the worst-case scenario.
That's a key distinction that makes this finding so actionable for you, the listener. It means if you have a high CTI score, vigorous activity is not increasing your risk. It's actively working overtime to prevent your existing metabolic crisis from escalating into full-blown, ever-increasing disease.
Right. While those who are only lightly active, they lack that emergency brake.
It speaks volumes to the dynamic, compensatory nature of exercise. It reinforces that CTI is an accurate predictor of underlying metabolic function, regardless of your fitness level.
Yes, but your fitness level dictates how aggressively your body can mitigate that risk.
So what does this all mean for daily practice? How can the CTI index practically help people manage their health?
I think the CTI index is a valuable tool for early risk identification. It has immense practical utility. It's calculated from 3 routine, really low-cost lab tests: C-reactive protein, glucose, and triglycerides.
Tests that many people are already getting.
Many people are. If you're over 45, you should be asking your doctor about these numbers and seeing how they integrate. It's a simple metric that allows for highly targeted intervention.
It sounds like it.
Absolutely. It helps identify those high-risk subgroups we talked about: men, middle-aged adults, and especially those individuals with low physical activity levels who suffer the most immediate and unprotected consequences of a rising CTI score.
The goal, then, is to catch that high CTI early and intervene.
With tailored lifestyle adjustments, yes.
So the ultimate takeaway is that CTI acts as an early alarm bell, screaming about 2 deep metabolic problems, and the research shows that physical activity, particularly vigorous activity, serves as a highly effective, dynamically regulating emergency response system.
It's not just about losing 5 pounds.
No, it's about regulating your internal biological signaling.
That's the point. We need to start viewing exercise not merely as a fitness routine, but as essential metabolic medicine that modulates insulin resistance and inflammation at the cellular level. And this study provides a powerful biological marker to prove that mechanism actually works.
And that leads us to a final thought for you to consider. Since CTI is such a powerful integrated marker, future research really needs to investigate whether lifestyle interventions designed specifically to aggressively lower the CTI score, not just treating the resulting dyslipidemia, actually lead to better long-term cardiovascular outcomes for that midlife population.
Focusing on the root cause rather than just the symptoms, it's always the most promising path forward.
This has been a fascinating deep dive into a powerful new predictor of metabolic health. We really encourage you to read the full article. Physical activity modifies the association between C-reactive protein triglyceride glucose index, CTI, and dyslipidemia for all the data and the detailed discussion.
It's an essential read for anyone serious about preventative health.
Thank you for joining us. If you found this discussion valuable, remember to follow the channel and turn on notifications so you don't miss our future deep dives into the science that matters most to your life.